Hello, and thank you for your interest in the Administrative Fellowship at UTMB. This presentation will provide information regarding UTMB Health and the Administrative Fellowship Program at the University of Texas Medical Branch in Galveston. My name is Austin Loomis, and I am the current Administrative Fellow for the UTMB Health System. I completed my Master's in Healthcare Administration at St. Louis University. Prior to pursuing my master's degree, my experience in healthcare included interning at OU Children's Hospital and shadowing executives at Great Salt Plains Health Center and Great Plains Regional Medical Center. My undergraduate background is in healthcare administration and finance.
My name is Jessica Masato, and I was the Administrative Fellow from 2018 to 2019. I currently work as a project manager for ambulatory operations. I completed my Master's in Healthcare Administration at the University of North Texas Health Science Center.
During this presentation, I will discuss UTMB's organizational history, structure, and some of the future initiatives the organization is pursuing. We will also cover the Administrative Fellowship structure, preceptor, and the various types of projects with which fellows have the opportunity to be involved. UTMB has had over 40 successful fellows, and some of the executives and directors are former fellows from various institutions. We are in unique times, to say the least, with COVID-19. But we are also in a time of system-wide growth, allowing the fellow an opportunity to work on a variety of projects. Fellows will have continuous exposure to the executive team and the opportunity to network with Texas Medical Center fellows.
UTMB's main campus and administrative hub is in the city of Galveston, Texas. There are two major industries in Galveston: tourism and healthcare. The summers are the busiest times for both. Patient volumes typically peak from June to August. UTMB is located 50 minutes outside of Houston, so employees are able to experience both island and city life. Galveston is also home to 32 miles of beaches and numerous events and festivals, such as the largest Mardi Gras celebration in Texas. The mission of UTMB is to improve health for the people of Texas and around the world by offering innovative education and training, pursuing cutting-edge research, and providing the highest quality patient care. UTMB is comprised of 4 schools and home to the state's first medical school, which is currently one of the largest in Texas. UTMB receives about $200 million in grants and contracts for research purposes. The UTMB campus includes the Galveston National Lab, one of 2 biosafety Level 4 labs in the U.S. The Galveston National Lab is working on developing vaccines for many of the world's infectious diseases, including the Zika and Ebola viruses. Of course, the Galveston National Lab has also been hard at work studying and conducting research related to COVID-19. UTMB Health is designated as the only Level 1 trauma center in Galveston County. We advance patient care by using technology, research, and innovative care models to improve health outcomes for the population we serve. UTMB has an extensive telemedicine program used for research and patient care. This allows us to provide patient care to patients at correctional facilities throughout Texas, on cruise ships, in Antarctica, and at community clinics for the underserved. As the Region 2 anchor for the Medicaid 1115 waiver, we help support the establishment of regional healthcare partnerships to improve health organizations' ability to meet community needs. This map illustrates the expansiveness of UTMB throughout Texas. In addition to the care we provide in the Bay Area, we also have correctional managed care and the regional maternal child health program clinics throughout the state. After Hurricane Ike, UTMB began growth strategies for delivering care to the mainland. This map illustrates the clinics and hospitals that have opened as of March 2019. We have close to 90 outpatient clinics as well as 4 hospitals, the main medical center in Galveston, and 3 regional hospitals in the Bay Area. One unique attribute of UTMB is that we are home to Hospital Galveston, the only hospital in the nation that is focused solely on offender care. Our economies of scale, combined with advanced telemedicine, allows us to provide an extremely efficient model of care, resulting in more than $1 less per offender per month, making us the most cost-effective in the nation.
The Angleton-Danbury Campus provides a variety of quality services, including 24-hour emergency services, an ACR-accredited mammography program, cardiopulmonary clinical laboratory, diagnostic imaging services, outpatient surgery, rehabilitation, physical therapy, and much more. UTMB opened the new Clinical Services Wing in Jennie Sealy Hospital in 2016. The hospital contains 310 patient rooms, including 54 highly advanced ICUs and 20 state-of-the-art operating suites. League City Hospital is located about 30 minutes north of Galveston, in a growing community, and is in partnership with MD Anderson for oncological care. The Phase 2 expansion of League City campus includes the construction of a 264,000 square foot, 5-story patient tower to serve the growing demand of the market. The tower, or more commonly referred to as South Tower, opened in March 2020 and features 2 ancillary floors with expanded space for the pharmacy, clinical lab, and blood bank, sterile processing, environmental services, patient transportation, kitchen and dining, and supply chain. The tower also adds 60 additional inpatient beds to the campus, with capacity to treat 97 inpatients. The expansion also added a 750-stall parking garage, medical plaza building, and a conditioned sky bridge to connect the garage to the hospital. The expansion also added a 750-stall parking garage, medical plaza building, and a conditioned sky bridge to connect the garage to the hospital. The interior renovation work at the League City campus included outfitting 3 shelled operating rooms with equipment, installing the Da Vinci robot, converting the old labor delivery recovery postpartum suite to 17 ICU beds, adding a 6-bay fast track and 5 private rooms to the emergency department, relocating the CT and X-ray imaging suite as part of the Grand Concourse phasing plan, and much more. The original John Sealy Hospital opened in January of 1890 and became affiliated with UTMB 1 year later. The current John Sealy Hospital building was built in 1978 and now serves as the hub of inpatient care for women and children's services. A major renovation is underway, which includes significant interior redesign, as well as replacement of the building's facade and covered driveway. At the expected completion of the project in 2022, women's and children's inpatient care will be fully consolidated from adjacent buildings into the John Sealy Hospital, with expanded capacity for pediatric patients and mothers and babies. In March 2019, UTMB Health began operations at our Clear Lake campus, allowing us to further expand our reach into the mainland. This facility offers a comprehensive range of services such as endocrinology, labor and delivery, orthopedics, cardiovascular care, neurosciences care, and much more. There will be opportunities for the fellow to get involved in projects and rotations at this new campus. The fellowship at UTMB is a year-long program, which will begin in the summer of 2021. The administrative fellow participates in the day-to-day health system operations and works closely with an accomplished senior leadership team on a wide array of projects and initiatives. Mentorship is a strong component of our program. Fellows have significant exposure to the executive team and are expected to attend and participate in weekly executive meetings, health system executive retreats, and project work with executives. The preceptor for the UTMB Administrative Fellowship is Pete Gutierrez. Pete leads UTMB's network of primary, urgent care, and specialty care clinics. He works closely with ambulatory leaders and other colleagues in the academic enterprise to ensure the best and safest outcomes for our patients. Pete brings with him a wealth of experience and a history of collaborating with providers to achieve great results. For much of the past 2 decades, Pete led the extensive ambulatory operations at Denver Health, including as Associate Chief Operating Officer, Administrative Director, and Operations Coordinator. One of his many accomplishments while at Denver Health was to help lead the effort that resulted in a $20 million ambulatory innovation grant from CMS to transition traditional ambulatory care to a value-based model. Pete also had the opportunity to lead an award-winning lean transformation at Denver Health. He was the process owner of the ambulatory value stream that won an Operational Excellence Shingo Prize Award, the first healthcare organization to win this international award. Pete received his Master Black Belt from Denver Health's Lean Academy. He enjoys teaching and leading challenging process improvement initiatives. This slide gives an overview of the projects I've started to get involved with and the opportunities I've experienced. My goals for the fellowship are to achieve a well-rounded experience and bring value to UTMB and contribute significantly to our health system initiatives. I want to dive deeper into personal interest areas of mine, like productivity, operational excellence, and business development.
Here's a snapshot of the projects I worked on during my time as a fellow. My project allowed me to work with various areas around the health system, which gave me the opportunity to work with various stakeholders and processes in both inpatient and outpatient setting with clinical and non-clinical departments.
To apply for the fellowship, a complete application packet must be submitted by September 25th, 2020, and an online application through Human Resources. The packet should include a cover letter, resume, unofficial graduate transcript, 3 letters of recommendation, a personal statement, and an application checklist, which can be found on the UTMB Administrative Fellowship website. We will review the applications after the September deadline and conduct phone interviews early October, and have on-site interviews in mid-October. For more information, please visit www.utmb.edu/administrative fellowship. This concludes our presentation. If you have any questions, please contact me at the email or number listed on the slideshow. Thank you for your interest in the Administrative Fellowship at UTMB.
UTMB Health, working together to work wonders.